Hi, in today's video we'd like to come back on another common diagnosis and condition that women face, which is uterine fibroids. Now on the diagram here I have a very brief descriptions of the different types of uterine fibroids, and let's go through it together. So most commonly we will look at three types of different uterine fibroids depending on where they grow. And depending on where they are, it might threaten your pregnancy or cause some difficulty in conceiving a pregnancy. Now the most common one is that we see the Sub-Serosa Fibroid, which is furthest away from the uterine cavity. Usually it grows protruding from the uterine wall, going towards the outer layer. This is known as a Sub-Serosa Fibroid. Then the second type is an Intramural Fibroid, right here, you can see, which is growing within the walls of the uterus, which is much more difficult to detect when we need to use a laparoscopic diagnosis or even ultrasound to actually figure out its presence. And then lastly is the most threatening one, which is within the uterine cavity itself, which is protruding inside into the uterus, inside the uterine cavity here, which is known as a submucosal fibroid. Submucosal means half of it is within the uterus's wall, and then the other half is facing inside the uterine cavity. Now, why do I say this is the most threatening one? Is because let's say you have a pregnancy nearby. The submucosal fibroid is also another form of a living organism, which means it's an organelle that needs nutrients, oxygens, and blood flow to allow it to grow as well. Although we don't want that, but that's what happens here. So assuming there's a pregnancy here, this pregnancy also needs the same thing that the fibroid needs. So there will be competition between these two. So the closer the pregnancy is to this fibroid, the more dangerous it is. Which is why I say a Sub-Serosa Fibroid, if you have this during pregnancy, very unlikely that it will affect your pregnancy, but it also depends on the size as well. So if it competes, the nutrients, oxygens, it is very likely that your pregnancy will end in a miscarriage within the first trimester, if it's very close to it. If it's not so close but also threatens it, then it might happen a bit later on, but usually it happens within 12 weeks. So usually, if you want to prevent stuff like this, then you need to go for a full diagnosis before pregnancy. That is the best case scenario. It is not recommended that we want to do any type of surgery during pregnancy, although it can be done, especially here at the hospital. We can have it done as early as possible if it's found early within the first 12 weeks. We can have it removed so it doesn't affect your pregnancy. So here at the hospital, we have a very special treatment system for uterine fibroids. We call it Antai 414 surgical system for uterine fibroids. So the 414 system. The first four is regardless of the size of the fibroid, no matter how big it is or how small it is, regardless of the quantity of the fibroids, regardless of how many are there inside the uterine cavity or outside the uterine cavity, and regardless of your patient age, and also regardless of your medical history, we can effectively use one treatment method, which is 3D laparoscopy and hysteroscopy. And also we give you 4 final guarantees, which is no blood transfusions during this surgery, no transabdominal surgery for this surgery, because transabdominal can lead to more complications such as adhesions. And then the third guarantee we give you is that there is no recurrence of this fibroid, which means this fibroid will not come back in the future. And the final guarantee is that there is no hysterectomy required. So hysterectomy is a very common conventional treatment, which means they will remove the entire uterus. So our hospital does not do this, and this 414 system has benefited many patients, especially those who are seeking to have healthy pregnancies. We offer this as a full contractual treatment. If we do provide you unsatisfactory treatment results, then we will offer you a full refund guarantee. So if you'd like to find out more information about this treatment, please visit our website and also leave me a comment down below.